Hi, I'm Tiffany Gladney with your weekly legislative update for child advocates. What a week, y'all. Late Wednesday afternoon, cell phones began to ring, and the Twitterverse began to buzz with news that a Medicaid expansion bill would be coming out of the House. That bill was presented by none other than Speaker Moore in the House Health Committee. We'll share more details on that committee meeting and that bill a little later on. But there's not a lot of time left for debate. House and Senate leaders are making it pretty clear that the session will end before the July 4th holiday, whether they reach a budget agreement or not. The biggest fiscal item on the table is a raise for teachers and other state employees, which all sides seem to agree is important. But of course, the devil is in the details. On to the bill summaries for this week, though. So on the health front, we saw Senate Bill 408. This bill is formally known as the Stop Addiction Fraud Emergency Act of 2021. Republican leaders, including Speaker Moore, filed the bill, which creates a pathway to expanding Medicaid. But to be clear, this bill does not actually expand Medicaid, but it would move the state one huge step closer. The bill is up for discussion in the House Health Committee Thursday, June 23rd, and some of the bill provisions include creating a joint legislative committee. Yes, another study committee that would hear about Medicaid plans to be developed by the Department of Health and Human Services by December 15th, 2022. The plan would also add Medicaid coverage for adults ages 18 to 64 with incomes up to 133% of the federal poverty level, increase hospital assessments to provide funding for the non-federal share of the cost of the additional Medicaid coverage, and invest $1 billion to address the opioid, substance abuse, and mental health crisis using savings from the additional federal Medicaid match available under the American Rescue Plan Act, also known as ARPA. And those are just a few of the provisions. Be sure to check out our legislative update in your inbox for more details. But the committee would make This joint legislative committee would make recommendations regarding the plan, and the General Assembly would take action in part or all of the plan on or after December 16th of 2022. The bill also directs the Secretary of Commerce to collaborate with stakeholders to develop a plan for a comprehensive workforce development program. And finally, the bill directs DHHS to pursue work requirements for the Medicaid program if there is an indication at some future date that work requirements will receive federal approval. The Health Committee heard this bill Thursday, but they didn't vote on it. So stay tuned for more details on that bill. Then there was House Bill 144. This legislation authorizes DHHS to issue an RFP for managed care entities to run the Children and Family Specialty Plan as an additional Medicaid managed care plan. This would represent a huge shift from the current county-by-county system of Medicaid plans for foster children to a single statewide specialty plan. The bill does make other changes to Medicaid managed care statutes. This bill passed the Senate late last week and is now awaiting consideration in the House Rules Committee. And other bills of interest, we saw Senate Bill 671, which is a somewhat controversial bill because so far, virtual academies and virtual learning have shown poor results in terms of student performance. All the same, Senate Bill 671 would expand virtual learning options for students in North Carolina through several provisions. But because the House and Senate didn't agree on changes to the bill, a conference committee was appointed this week to work on conference language. Conference committees are initiated when both chambers are unable to agree on language. Chamber leadership appoints representatives from the House and the Senate to work out the differences that hopefully will result in language both chambers can accept and pass. And then there was Senate Bill 101. This bill has not moved since it passed the Senate in March of 2021, but saw a resurgence this week. Senate Bill 101 requires sheriffs to cooperate with ICE with several provisions, including creating reporting requirements related to ICE queries, requires local sheriff's departments to consult ICE when an individual charged with certain offenses is in custody and their citizenship status is in question, requires local judicial officers to hold a suspect in its local facility for 48 hours or until ICE resolves the immigration status inquiry. Senate Bill 101 passed the Senate in 2021, but this week was re-referred to the House Judiciary 4 Committee. It has not yet been assigned a date for consideration. And y'all, that is this week's update. Of course, additional resources are posted on our weekly updates webpage. You'll also find our real-time bill tracker there with all the bills we're monitoring. Between now and next Friday, if you have questions you'd like for us to address in the Friday updates, send them my way. I'm always happy to hear from y'all. And with that being said, make it a great one, y'all.